So when a patient has a heart event or is diagnosed with heart disease, it's a life-changing moment for them. There's a lot of different feelings going around. It's very shocking at times. The Cardiovascular Institute of the South does a really good job at treating the patients and stepping in when they do have a heart event. What we provide for the physicians is to provide the next step in their plan of care. So we monitor the patients after their event, make sure they're not having any symptoms or problems. We address any questions or concerns they may have with anything related to their heart event or just what they do from now on. Some people are just overwhelmed. So we provide kind of that transition period for those patients as they try to move on with their life after this event. In the program, we focus on 3 basic areas. One of them is exercise, the other is nutrition, and the other is basically stress management or behavioral areas. And so we try to reinforce to the patients that even though each one of these is important to their overall heart health, all of these together form the best holistic approach to maintain and improve their heart health. So when a patient comes into the program, we basically lay it out to where we want to tailor it to them. We want it to be feasible and easy for them to commit to, because we know whatever they can commit to in the long run, they're going to see the most benefit. We have a very diverse team of individuals. Everybody kind of touches the patient in different ways, but it all just brings it back to that holistic care that we're trying to provide for the patient. We pride ourselves on being more than coaches or more than clinical staff for the patients. We really want to get down to why they came to us and what they need from us, and just provide that better quality of life for them.